Meals on Wheels is one part of government that truly understands the connection between the heart and the head. It touches the heart because I saw when you bring a nutritious meal to seniors, you can spend time visiting with them at home, and often they will tell you that you're the only visitor they will have during that day. And it causes you to use your head and a sharp pencil because you can see without Meals on Wheels, as sure as the night follows the day, some of those seniors are not going to be able to stay in the community, and they will end up needing institutional services. And those services are more costly, and of course, seniors will often be less happy with those kinds of institutional programs. And I bring up Meals on Wheels today, Chairman Conrad, because several of the proposals that are offered by colleagues on the other side of the aisle, they're not going to be bipartisan because they cut the part of the budget that funds Meals on Wheels substantially. In several instances, specifically, through our research, between 17 and 59% in just the upcoming year. Now, putting Meals on Wheels at risk like that just defies common sense. And I think what is common sense is what you, Chairman Conrad, have touched on, and other colleagues, and that's tackling the big issues on a bipartisan way. And certainly when it comes to Medicare, that's what's needed. If nothing is done, the Medicare guarantee is in peril, and my own sense is that Medicare, because it's already facing cuts with sequestration, as Chairman Conrad has pointed out, Medicare, if nothing is done, will face a steady diet of benefit cuts and cost shifting until we do not recognize the Medicare guarantee as it stands today. That's unacceptable to me. It ought to be unacceptable to every member of the Senate. And as Chairman Conrad has noted, Medicare reform is going to have to be bipartisan. And I'm interested in working with every colleague here in the Senate to pursue it. Here's what it's going to take. First and foremost, it will take protecting the most vulnerable seniors, what are called the dual eligibles, seniors who are eligible for both Medicare and Medicaid. The protections for those dual eligibles must be ironclad. The second part of Medicare reform is to ensure that you protect traditional Medicare where the government pays doctors and other providers for services, as well as private sector choices that have to offer at least as good coverage as traditional Medicare. And by doing that, you force traditional Medicare and the private choices to hold each other accountable. Third, Medicare reform, and we went into this in a very good hearing that was held in Chairman Conrad's Budget Committee, is going to require comprehensive consumer protection. I'm committed to bipartisan Medicare reform. I think Medicare is really a sacred ground. It can only be preserved and protected by ensuring that we take the steps, I've just outlined 3 or 4 of them here this afternoon, that ensures that we put seniors and their well-being before ideology and politics.